We all know that the consequences of being tired or distracted while driving can be catastrophic. When we get behind the wheel of any vehicle, we have an individual responsibility to make sure that we are alert, well-rested, and aware of our surroundings. The dangerous risks of fatigue, alcohol, and drug use are well known, and legislation exists with severe penalties for anyone who is so careless. However, there is another condition that also poses a major risk when driving. Those who suffer from it may feel confused, dizzy, aggressive, or even lose consciousness while they are behind the wheel. Even more alarming is that many people don't know that they even have this condition. It is caused by having extremely low blood glucose levels and is known as hypoglycemia. This condition is a common symptom of diabetes, a disease that affects potentially 1.7 million Australians, up to 50% of whom may not be aware that they even have it. A person without enough glucose in their bloodstream is likely to experience a range of physical and mental conditions that make it extremely dangerous to be driving a vehicle. Mentally, they may have trouble with their coordination, decision-making, and feel uncommonly aggressive. Physically, they may also experience blurred vision, headaches, or even seizures and loss of consciousness. This puts you, your family, your workmates, and every other driver on the road at risk. For this reason, it is important that anyone who has diabetes understands why hypoglycemia can occur, and how to make sure that when you get behind the wheel, your blood glucose level is high enough to keep you and those you love safe. So why do people with diabetes sometimes experience this condition? Let's have a look. Hypoglycemia occurs when a person has an extremely low level of glucose, the body's main source of energy, in their bloodstream. Our bodies absorb glucose into the bloodstream when digesting food, in particular carbohydrates. Once in the bloodstream, glucose is carried into cells by a hormone called insulin, where it is used to create energy. People with diabetes have difficulty producing or using insulin, and therefore absorbing glucose to produce energy. To help with this, they need to inject insulin or take medications that help their body make use of insulin more efficiently. This allows them to keep their body topped up with energy and a normal level of glucose in the bloodstream. The danger for people with diabetes is that if they take their medication but don't also eat to provide the body with enough glucose, they will use up the existing glucose in the bloodstream faster than the body can replace it. This can happen for a range of different reasons. A person with diabetes might take too much medication or the wrong type. They could skip a meal or fail to eat enough carbohydrates with their meal. Without glucose, organs in the body can struggle to function effectively. As a result, people experiencing hypoglycemia can often feel anxiety, heart palpitations, tremors, sweating, tingling, or nervousness. The brain is an organ that demands a constant supply of energy. Without enough glucose, a person with diabetes might start to feel confusion, blurred vision, fatigue, aggressive behavior, headaches, speech impairment, seizures, or even loss of consciousness. As you can imagine, a person experiencing these symptoms while driving is a major danger to themselves, passengers in their car, and other people on the road. When a person experiencing hypoglycemia is in an accident, it can be difficult to treat them as they may be confused, unconscious, or even aggressive. The main treatment for hypoglycemia is by supplying the body with a quick dose of glucose, which can be difficult to give a person in this kind of state. Medical professionals can often miss the hypoglycemia as they are busy dealing with more apparent injuries. Some treatments used to deal with injuries can even make hypoglycemia worse. Lastly, as hypoglycemia denies energy to important organs, the body is less able to cope with the trauma often experienced in an accident. This is especially true of the heart, which must work harder to cope with injury, but without the energy it needs to keep up. Taking time out of your day to check your blood glucose level before you drive can seem impractical, especially when people are relying on you. But the consequences of ignoring the early symptoms of hypoglycemia could be much worse. The accident you cause could cost you more time, your job, or even your life or the life of somebody you care about. Survive this drive. Remember, 5 to drive.